we have a family who was a part of that care. They wrote a letter. Would you mind reading that, please?
Sure.
Go out loud. Okay. Okay.
And I have a copy of it here for you.
Dear Amy, I just wanted to convey to you and your very fine staff, how impressed we have been with your services.
My wife was in Peoria that day with a retired OSF nurse, Margie Lewis. That's been with us since December. I received a call from the OSF Infusion Center saying they could not move forward with the chemo that day due to my wife's declining health.
So we ended up meeting with our oncologist, who made the time to see us, and she explained our limited options and hospice was the only viable option.
We were contacted that same afternoon by Jamie Derry, hospice liaison, who was making an appointment to come out to our house the next morning at 8:30 to go over how and what hospice provides for services and got us signed up to begin the service. She was very thorough and caring and made my wife and I both feel very comfortable with the whole new process.
Patty came out and did such a wonderful job of making my wife feel at ease. She was very informative, helpful, caring, and so knowledgeable. We both looked forward to having Patty be our primary contact for my wife's many needs as we move forward through this process. Nothing has approached the excellence of OSF Hospice. We want to express our gratitude to their fine professionals.
We hear it often, in the community, but it's really nice that someone took the time to acknowledge our staff because they do work really hard and sometimes they don't always get to be celebrated for what they do.
There is one comment he did say to me when he brought the letter in. He said when Patty came to see her, they were in the other room, they were laughing. And he said, I just didn't think we shouldn't be laughing. He said, I didn't realize we don't laugh anymore. So I think it showed him that just because, his wife was dying, we can still live to the fullest.
It's an honor to care for God's people. And we have the honor to help kind of take on some of those burdens and help relieve them of them while they're going through this process, this transition. And I feel blessed that I have such a wonderful team because we all carry each other through this process too, because we mourn, we lose sleep, we worry that our patients are being okay and that their families are coping with this okay. So we all share each other's burdens, and to be able to provide that the Lord gives us the strength and the skills to help people through this is what our main goal is. I'm glad I've been able to do this for the last 17 years. It's not an easy job, but it's a fulfilling job.